Assalamu alaikum, the communication day. The first scenario, you are the registrar on the oncology ward. The problem discussing the management of the terminally ill patient with her daughter. The patient daughter, Mrs. Dennis Harrison, 59 years old woman. The patient name is Mrs. Elizabeth Williams, an 85 years old woman. The background of her, she was diagnosed with endometrial cancer 4 years ago, for which she had a total abdominal hysterectomy. Unfortunately, she developed recurrent disease 3 months ago and currently has hepatic and bony metastases. A palliative approach has been agreed between Mrs. Williams and her consultants, and no further active treatment is planned. Unfortunately, she was admitted to the oncology ward at the weekend with poorly controlled back pain. Mrs. Williams' daughter, Mrs. Harrison, has expressed concern at the continuing pain that her mother is experiencing. She has asked to speak to you today to see if anything else can be done to relieve her mother's distress and to help her to die in peace. Your task is to speak to Mrs. Harrison regarding her mother's current condition and the management plan. Ready, Dr. Al-Huda? You can start. Dr. Al-Huda, we cannot hear you.
Hello.
Yes, okay.
Hi, doctor.
Okay, here you go.
Hello.
Hi, doctor.
Hi. I'm Dr. Naji, one of the doctor in the ward today. Are you Mrs. Denise, relative of Miss Elizabeth, 85 years old?
Yes, that's me, doctor. I'm Dennis.
Are you next kin for Miss Elizabeth?
Yes, doctor, I am.
Okay, nice to meet you, Miss Denise. We are here today to discuss some issue about your mother health condition. It's okay with you?
Yeah, sure. Yep.
Okay. Miss Denise, you can tell me what you know about your mother condition?
Okay, doctor, just to be brief, my mom had our womb removed about 4 years ago because she has cancer. And we've been told that that is going to cure her. But unfortunately, she developed a spread even after the womb has been removed to the bone and to the liver, which is quite distressing to us as a family. All right. That being said, it's not your fault, doctor. That being said, my mom came to the clinic to see the consultant, and they had a chat with my mother, that they're not going. She's not for any form of treatment anymore. When she returned back home and told us about this, I must tell you that, doctor, we are not happy about this. No, because I believe this decision was made solely because my mother is young. I mean, she's old. They don't want to give her treatment because she's old. That is really, really making me unhappy. That being said, it's okay, doctor. Like I said, it's not your fault. That being said, only for her to develop a back pain. I understand that they've been giving her some treatment, painkillers, managing her, and she's been responding. Sometimes she's a bit drowsy. This is so distressing for us. And now she's have back pain despite giving her this lot of painkillers. No, I'm not just happy. I must confess to you, doctor. I'm not just happy about it. If she has been on painkiller, why then did she develop a back pain?
I'm sorry for your feeling, Miss Denise. I am sorry for this situation for your mother, and really I highly appreciate your feeling, Miss. But we are here today to try to help your mother, and we try to give her the best. Okay, we will try to do the best for your mother, Miss Denise. It's okay.
Okay, good. I'm happy to hear that you want to do the best. So, what best do you want to do for her apart from the palliative thing that has been set up for her? What other things? What is the best that you want to give to her today?
Okay, Miss Denise, as you know, your mother, she is fragile and she has this cancer since 4 years. And you know, the disease it's spread to another area like liver and bone.
Mm.
I'm sorry, you know that this cancer it's destroy the bone. For that, she's suffering from this pain. In her situation, we cannot treat the cancer because the benefit of the treatment by the chemotherapy or radiotherapy, it's no benefit in her case, as you know, and the harm more than benefit. I'm sorry to tell you that, Miss Denise. Are you with me, Miss Denise?
Oh, doctor, I'm following you.
Okay. We choose for her what's called palliative treatment. You have any idea about this?
Yes, I do. She told me already about this, all of this. The painkiller, which is being taken at home. She's also with a pump now that's giving her some of the painkiller. Even sometimes she becomes drowsy at home. You know, she's just not just the usual my mom that I used to know. She's not just anymore. My mom is, I don't know. I don't just know. This is just a lot for us. It's a lot. It's a lot, doctor. It's a lot.
I'm sorry, really, I'm sorry, Miss Denise. Take this water, Miss Denise.
Okay.
I'm sorry for your feeling. You want us to complete, or we can delay the discussion later to another time?
It's okay. We can continue. I'm all right now. Thank you.
Okay, Miss Denise, the palliative treatment, this is type of treatment. We try to uh, we need the patient to feel comfortable. Okay, for that we try to give him painkiller. Okay, whether there is many type of the painkiller we can give your mother to control this pain, Miss Denise. Okay.
Okay,
We
doctor.
can also, yes, we can give her this painkiller to relieve her pain. Okay, Miss Denise,
Mm.
and we can, yes. Okay, Miss Denise.
All right, doctor. I quite understand all of this, but my mom is just in pain. I'm sad looking at her, watching her go through all of this. Doctor, I don't know. Is there something that you can do? I know she's gonna die anyway, because yeah, I've never seen my mom as this as down. Are you able to do something for us? Something that that would make her die peacefully instead of going through this pain. Is it something you can consider?
I'm sorry. I appreciate your concern, Miss Denise. But what we will do for your mother now, we try to keep her in the comfortable situation. Okay. We will try to talk with the team, the pain management team, to try to give her the best painkiller to control the pain, Miss Denise. Okay. And we also talk uh, with the specialist nurse to follow with her. Okay.
Mm.
Miss Denise, it's okay with you?
Yeah, it sounds good. But then I was just wondering if you can just help in one way. Doctor, no one want to watch their loved one die this way, being in the pain like my mom is going through. You can see what she's going through. It's not nice. It's not dignifying at all. Are you able to do something for us? Something to just, hasten her and, just make her die peacefully, sort of. You know what I mean, doctor?
I appreciate your concern, Miss Denise. But as I told you, we try to give her the painkiller to control the pain, okay? And I'm
Mhm.
sorry to tell you, if her heart stopped to beating, we not do for her the resuscitation, Miss Denise.
It's
I'm
okay.
sorry to tell you that. because
2 minutes.
your mother, she's suffering a lot. For that, we need to decrease her suffering. If her heart stop to beat, we need do that compression in the chest. It's more harmful for her and no benefit for her, Miss Denise. It's okay.
Yeah, it's
I'm
all right, but
I'm
it's all
sorry
right,
to tell
doctor.
you that,
It's okay,
but
doctor.
because she will suffering more from this injury and broken of the bone, and without any, I'm sorry to tell you that, without any benefit and or any for her life. I'm sorry, this is increase her severity. But if we let her to die in peace, it's better for her. Okay, and we will decrease the suffering time for her, Miss Denise. I'm sorry for that. Miss Denise, there is anyone depend on your mother?
No, not for now. No, no.
Okay, I'm sorry. You need any support, Miss Denise?
I'm not quite sure. If I don't know, except to think I need support.
I'm sorry for really. I'm sorry for your suffering and for also your mother. As I told you, we will try to do the best to decrease her pain. We will give her the good painkiller, and we will try with her to let her die in peace. I'm really sorry, Miss Denise.
All right, doctor, but I think animals even get better treatment than this, honestly. Yeah, it's not just nice. It's not nice. Just pain is just too much. But thank you anyways, doctor. Thank you.
Okay, you have any other concern, Miss Denise?
No, no, no.
I'm sorry, Miss Denise. Again, if you need any help, I give you the department number to contact with us, and some paper and web to read more about the palliative treatment, Miss Denise. It's okay with you?
Yeah, thank you, doctor.
Thank you,
Okay.
Miss Denise.
Okay, thank you. Well done. Time is up, Dr. Al-Huda. Now we can hear the comment from Dr. Ayula.
Okay, so thank you, Dr. Uda. Thank you. It was a good presentation, a good one, good setup, asking about my knowledge and everything about my mom. It was a good, I know it is quite a difficult station. More of emotion was poured into this station. I think I agree it is sort of difficult one, but you were able to navigate your way in one way or the other. Just one thing about my concern, which I think was not addressed, and that is the case of assisting to die. That was basically what the daughter was requesting for, but I'm not quite sure if you address that. Okay. And secondly, also, you saw how emotional the daughter was about the pain that the mom was going through. And you asked her about if she needs any support. At this time, I think you offer her the support. You tell her the support that you think she might need at this point. Obviously, she's overwhelmed. For her to ask to help her mom to die, she's overwhelmed. And palliative care also encompasses the relative as well, support the relative, which include counseling to them, emotional support, which psychologists can do for you. So something like, oh, I know you this having to look after your mom and see your mom go through this can quite be overwhelming, Mrs. Harrison. How about we organize a meeting with you with the counselor? Maybe you might be able to pour out your mind to them, and they might be of help. What do you think about that? Just offer her that sort of care, and yeah, basically that's just the two thing I think I needed to point out. And the issue of the helping that mom to die, well, the cancer, the concern was not really addressed. Okay, because I was asking that, of course, we all know that it's illegal to to do such. And of course, that is when you start talk about non-maleficent. Just let the patient know, the relative know that you have a duty of conduct to the mom to help her as much as possible, not to cause her any harm. So you are going to make her comfortable as much, which you did. Make her as comfortable. If you have any pain, if you need to talk to somebody, you will turn her regularly in bed. The feeding, you ensure that it's adequate for her part time as much as she can tolerate. Just basic palliative care for her. And then you now have to let the patient, let the daughter know emphatically that this that you are requesting for, I'm sorry, I cannot do it. It is illegal. And it does not, it's just against the duty I have towards your mom. Just make it sound like take your stand and let the examiner know that you are taking that stand but altogether it was a good scenario, a good presentation. I might mean to say, I know it's quite a difficult one, I agree, but well done.
Okay, thank you, Dr. Ayula. So I have a question now for you and Dr. Maida, since you are in UK. If she asked to give the patient a medication to end her life, is this something accepted there?
No.
Because here, yeah,
No.
even, yeah,
No.
okay. So it's clear, it's not accepted even if she asks. But they accept to remove the ventilator, right?
You can remove ventilator
Yeah,
if,
but
yes,
yeah,
but not
because
to die.
yeah, in Middle East or the Gulf, I mean, they will not give medication and they will not remove the ventilator. So the difference between you and here or UK and here, that the machine can be removed, but here we cannot remove even the machine. But in both of the areas, I mean the UK and the Gulf, they are not giving any medication to end the life. For example, opioid or strong medication that it can stop the heart. So I was about to mention this point, or it was about to be mentioned by the surrogate, I think. Dr. Ayula, is it one of the concerns that can you give mom a medication that it can end the life, or it's
Yes.
not?
Yes, that was one of the things I was trying to tell her about, that
Yeah,
could she give us something to help her die quickly.
but this is not eligible.
Is that no, it's not.
Oh, okay, so they will not accept it. Okay, so be ready, Dr. Al-Huda, because yeah, I think in the overseas they will not offer this concern. Maybe in the UK only. Anyway, it's not accepted anywhere in the whole world. No one can give a medication to end the life. Okay,
Uh,
but
Sorry,
yeah,
one more thing I need to say also, that
yeah,
at this point is also an opportunity to ask the daughter, that does the mother has any advanced will in her
yeah. This
care.
is supposed to be raised. Yes.
Mm.
Yeah, but as Dr. Maida mentioned, the lasting power of attorney, I don't agree to raise it because she might tell you, yeah, I am as a lasting power of attorney, or I am the one the taking decision on behalf of her. I decide to end her life. So you will have argument with her about this decision, which is against the medical advice or any advice against the medical advice. That's why I don't prefer to ask about the lasting power of attorney. Yes, you can ask about the advance directive. Did your mother write any wishes while she was okay? If she said yes, she want to die at home, okay, so we can facilitate that. You can take your mother at home and to be staying at the last moment of her life with you. Otherwise, yeah, we will let her die in peace. We will withdraw most of the medication. I agree this scenario is end of life care. Yeah, it started as palliative. However, the condition now is terminal and being worse. So what we will do, we will keep her pain free. We'll give her some fluid, but nothing else we can offer apart from this and oxygen. And if there is any medication given to the patient right now, we might stop it. Right? For example, antibiotics or feeding or any supportive medication like vitamins or anything she is receiving. What we will be sure giving to the patient, and we will ensure that she is pain free, strong painkillers. Sometimes, and in some scenarios, they are offering morphine subcutaneously. to feel or to just ensure the patient is pain free. So this is the most important point at this moment. The patient should be pain free, whatever the conscious level will be affected. Okay, so I will be sure that she's not feeling pain. As Dr. Hoda raised, it was good option to raise. We will call the pain management team to be sure that she's not feeling any pain. Otherwise, the support will not be for the patient, the support will be for the family. So you will feel pain, yes, as emotional pain. That's why, yeah, you can refer them to the spiritual team or the psychogenic support, psychological support, I mean, or social support. Even you can call your family member to attend this moment, okay? Because your mother is dying. She will raise this concern, or you can raise it. Anyone dependent, okay, no one. Anyone living with her, no one. Anyone want to see her, you can call them to come and to see her at the last moment or at the last days. You don't know for how long this patient will live or will live. She might die after seconds or minutes or hours, maximum days. She will not survive more than this. So the scenario will be going through as end of life care. Yes, I agree it was palliative initially, but now the problem is more complicated. The cancer is metastasized everywhere, and the patient in severe pain, and I think she lost the capacity. So we should let her die in peace. Sadly, yes, your mother will die maybe after seconds or hours, maximum days. Okay, this is my opinion. It's a different and difficult scenario, really. You don't know what they want from you. Is it palliative or end of life care? Yes, it was palliative. For me, it's an end of life scenario. Why? Because the palliative now no role for the palliative management at all. The patient will not survive with the feeding or the medication or antibiotics. She needs only to be pain free. This is in summary. Are you agree, Dr. Ayula? Or what's your opinion? Because you are the one bringing this scenario.
Yes, I agree that it's end of life care.
Yeah, okay, thank you. Dr. Huda, you have any question for this scenario?
Really difficult for me.
Yes,
I know
some
she
scenarios.
wants me to say that I can end her life, but I cannot say that for her. And that really
Yeah, that's why
difficult.
I asked this question at the first question I raised. Is it accepted in UK to raise this issue? If not, so don't allow and don't accept it at all anywhere. Okay, so we have a rule now. Even in the Gulf, anyone ask you to give a medication to end the patient life, it's not accepted legally. Okay, so it's not accepted at all anywhere in the world. I thought it can be accepted there in UK, but Dr. Maida and Dr. Ayula already confirmed that it's not accepted anywhere. But if,
Yeah, hi.
yeah, Dr. Maida, go ahead.
Okay, doctor.
Okay. Okay, go ahead. I
Yeah,
just want to add something in this scenario.
okay, you can add. Let's see
Mm.
what you want to add. Okay.
Yeah, so this is EUL. We agree that it is EUL.
Mhm.
If we just take the concern of the daughter, that's the main her main concern, that she can see that her mother is suffering from pain. That's why she need to end her life, because of her pain. If we just be a little bit like, we are not arguing with her, we tell her we highly appreciate your concern, and we know that you are suffering, and you are in pain because your mother in pain. We can understand that. But when we discuss that, the process of, let her die in peace, this is in this process will stop, because actually the EUL, it's another word for ending life, really, because you are giving, the main concern of the doctor or the team will be managing the pain. So when you are managing the pain, if the patient is not responding to low dose morphine, we'll give high dose morphine. Even this will cause respiratory depression. It still will give, because why? So in any mean, we are just concentrating in the management of the symptoms and keeping her in peace. And this is may kill her at the end. That's why when we discuss an EOL scenario, we let the daughter know that when we decide and when we agree that we can't treat her actively or palliatively, we will concentrate to make her comfortable. And if we decide to make her comfortable at that time, that means the nurse will not take her vitals. We will not take her vitals at all. And we give her medication to keep her comfortable. The palliative team will come will be with her all the time to make sure that she is pain-free, she has no secretion, and we can give her even oxygen if this keep her calm. And at that time, why we ask about the wishes, we'll ask about the last power of attorney and the wishes, both of them. If she has any wishes, if she has any advance directive or any wishes to die at home or in hospice care or where she want to die. Sometimes they ask about to die in their village where they are born. To facilitate that, so we will do a fast tracking her to the area where she want to die, and we ask if any member of the family is around. He need to come to see the mother before she die. It's open hour of to see the patient in her last days, so it is open hour of visit. Also the parking will tell them that the parking also will be free for any member of the family. And also we, if they want the, in addition to the palliative team, also the bereavement office, if she has any religious need,
Yes.
so we need
Visiting
to
time as well. Yes.
the open visit hour at any
Yes,
time.
exactly.
You can stay as far as you want. The important thing that we give her medications. This the pain medication, even this pain medication. By the way, even if her pain is not responding to high dose, we'll give her through the IV or not IV, subcutaneous and everything. Okay, so but we are not monitoring her blood pressure, nothing. Why? Because sometimes the medication we are giving, it can cause her death. That's why we are not monitoring. So when the patient, when the doctor say, can you give her medication like to kill her, we just phrasing what she's saying, that we know that you are worried about what you are worried about. You are worried about the pain. That's why you are asking to decrease her life or to just fasting her death. But we are not doing that. We are let the nature go to take its place.
Yes, exactly. Yeah, this is in summary. Yeah, so we will facilitate, but without direct effect. Yeah, we'll let her die in peace without direct effect on her heart or leading her to die immediately. But indirectly, yes, most of the opioid, it can lead to respiratory depression, and she will die because of this. That's
Okay,
why we are not monitoring. Yes, Dr. Alhuda.
okay, Dr. Bassem, if
Mhm.
I ask the relative if I ask about the last power of attorney,
Yeah,
that's meaning I waiting his take decision for the patient. In this
exactly.
case, I'm not
Yes.
accept any decision from him. Why I ask? For that, I'm not ask. Maybe I ask
Yeah,
about
this is
wishes,
Sorry.
separation.
You need to ask for a reason. Any care of patient is a medical decision. Even any patient have lasting power of attorney. The only thing that we are discussing, and we need the family, or if the patient is aware, we need their permission is end of life care. So even if we need to discuss if he has lasting power of attorney and he said EUL, and this is against our medical advice, still we go with the medical advice, because if the patient has lost, he has no, he's not he lost his.
Yeah, the problem is, Dr.
If
Maidas, sorry to interrupt you. Yeah, if he disagree for your plan, you will argue with him about the decision and you will lose the time. You will waste your time trying to
but we
convince
are
him.
in the same page, I think, in this patient scenario. Even if it is not, this is legal things. This is the important thing that even you will disagree with each other. It's important to see if he has lasting power of attorney or not, because EUL must be discussed with the family, and if they are not accepted, you are not going to do it.
Yeah.
DNR is completely medical, but EUL need to be discussed with the family, and if they are refused, still we are not doing it.
You will
EUL
not
is
do
not our.
AOL.
Yeah, if the family is not agreed, will not. It must be agreed with all the team. EUL need to
Why
be.
I will not do it? This is medical, another medical decision. Why I will not do
It
it?
is not completely medical decision. It's we need to have agreement with the family. We need to have agreement with the family that this is we will stop all the medication, we will stop everything. The only way, I think, this is scenario, in this scenario the patient is okay, she need her mother to be you try to convince the patient by any mean, but if they are not agree, we will not do the EUL.
I am not sure about this, Dr. Maida. If you have evidence about it, just share it with us. But anyway, whenever you ask about next of kin, this is fair enough to know that you are sharing the decision with them, but without taking their opinion. So, in order to save the time, if you ask about, are you the one taking decision of her or on behalf of her, she will say, yes, I want her to be managed actively till the end. And this is against our task. So, the task is to convince, not to argue. If you ask, you will take her to the pathway of argument, and she will tell you, "No, doctor, do everything for my mom. She's still young. She deserves a lot of care, and so on." So, to short all this story, and to cut short the story, better to not to offer not to offer this question for any surrogate, particularly if he feel the plan is against your management plan. Anyway, we will not do discussion or long time discussion about this issue, but the most important here is to ask about the advance directive. Did your mother ask or written or advise or express any wishes while she was okay regarding her management plan, how to be managed? She might tell you, yes, she asked to die at her village, as Dr. Maida mentioned, or at her home, or at hospital, or whenever or wherever she wants. That time we can respect the wish and we will do it. If she asks to die at home, we will facilitate the fast track discharge with all teams to shift the patient as soon as possible to her home to be dying in between the family members and to facilitate the death process there whenever she or it happens. This is my opinion again. Anyone has shared or documented opinion for this scenario, he can share it with us. Otherwise, we can receive the question. Anyone has a question? Okay. What is the abbreviation of EOL? No, it's EOL. End of life care, not EOL. EOL, end of life care.
Hello, Dr. Bazin.
Yes, Dr. Henry.
Yeah,
I guess. Yeah.
yes. I was thinking that in the United States of America, they have a constitution that's uphold such. I don't know. When you said there's no place in the world, I the time I listened to one of their stuff, their meeting, their judiciary meeting online. I saw something like that. I'm not so sure, but I have to confirm later and maybe get back to you. Concerning the euthanasia practice in the United States of America, USA.
You mean in the America they accept this, right?
I think so, but I think I'm not. I think
Okay.
I think so, but I'm not very sure.
Okay.
But I have to get the
Yeah.
information and get
Okay.
back
I'm
to you.
not sure as well.
Mm,
I'm not sure as well.
yeah,
Yeah, I guess I hear that. I heard some countries accepting it. I don't know where
yeah.
exactly, but I talk
Okay.
about paces and our
Okay.
exam
Okay.
belongs to PACEs, right? So
All
we
right.
are
Thank you.
talking about bases, not United Kingdom or the American board. Maybe there
Okay.
is acceptance there. I heard before, really. I heard about that. It's accepted in America, but it's not in UK. Thank you anyway for sharing this. Yeah, the question, Doctor. Okay, let's read the scenario for Dr. Ayula, then I will answer your question, Dr. Tahani. You are the senior house officer in the pulmonology unit, Mr. Samad, 30 years old pilot, and he's tall and slim. Heavy smoker, came with short of breath since one day. Diagnosed as spontaneous pneumothorax, treated surgically. It's quite resolved. Residual air is there, as shown by chest X-ray. Chest X-ray done 6 hours back. He is better now, waiting to leave. They told him he needs review from doctor before going. Discuss with him his condition and the flight possibility. Dr. Yola, your scenario, whenever you're ready, let me know.
Okay.
Okay, I will just mention for what the difference of palliative and hospice care. Yeah, palliative maybe include the hospice, so it's a major term. So the patient in hospice might receive the palliative. Okay, the hospice, I think it's the terminal cases. They are keeping the terminal cases there. They might receive the palliative as well. Okay, so the hospice is the place that patient, terminal patient will receive the palliative or end of life, whatever the decision. Is it clear, Dr. Tani? Dr. Alauddin, I think she needs to explain more about the pain management. She mentioned already, I think, the pain management team and the expected side effect of painkiller like morphia as it was main concern. Yes, we already discussed this issue. Thank you, Dr. Okay, thank you, Dr. Tahani. Yeah, good actress, really, Dr. Ayula, when she's surrogate, she's like professional one. Even you can believe that she's crying. And you can even offer her a glass of water or tea or coffee. She deserve it. And good candidate, of course. Dr. Huda also was doing well while doing the scenario. She was also sympathetic and empathetic. Yeah, we discussed the issue of lasting power of attorney, end of life care, palliative medication, but this scenario wasn't palliative. Dr. Maida, medical discussion. The healthcare team, doctors, nurses, palliative care specialists discuss the patient condition prognosis. Family agreement for patient family decision making. If this patient has decision making capacity there, if patient cannot decide, can conscious ideally advance directive or previous expression. The goal is shared decision making, aligning medical recommendation with the patients and family values, culture, and beliefs. So end of life care is not just a medical decision, it requires communication and where possible agreement with the patient and or their family. Okay, so you mean, yeah, sharing decision with the family?
Yeah, so always like saying that EUL is a shared decision, not a medical decision only, because some families believing, like if like us as Muslims, we are not believe in stopping medication and end of life care. It is not in our culture. So some people, this is not in their culture. That's why we need to have agreement that to understand the background of these families. And if they agree that to stop the medication and it is now time to keep this patient in peace, so we have this basement together. If no, we're still treating him until he die, because
Okay.
it depends. It is a shared decision. EUL is shared decision. This is what I'm trying to say.
Yeah, I got it.
Yeah, you share decision really.
Yeah, it's shared decision, but the argument it was about the agreement or not. So here they confirm that there is or supposed to have agreement with the family. So it's shared decision, not a medical decision. Okay. So if you want to, again, let's summarize. Whenever you are talking about end of life care, try to convince the family. As long as they accept, do it. If not, try to convince them If not, so you cannot do it. Okay, clear now for all? But the palliative will be continued. The end of life only to withdraw the machine or to stop the medication that's supporting the circulation, or the medication that patient need to be on, like antibiotics and so on. Okay, clear now for all? Let's start in the second scenario. Dr. Ayula, ready?
Yes.
Okay, here you go.
Hello.
Hello.
Hi. My name is Dr. Ayola. I'm one of the doctors here managing you. Are you Mr. Samad?
Yes,
Okay, all right. How are you feeling now, Mr. Samad?
I'm good.
Okay, all right. Before we proceed, can I just check your age, please?
You check what?
Check your age, your age.
Age? I'm
Yes.
30 years.
Okay.
30 years.
All right, good. So I understand that you've been with us on admission for quite some time now. Is that right?
Yes,
And you are ready to go home.
yes.
All right, good.
I
So
feel better now.
you feel better. Okay, good. So we're here to discuss, to review you just before you before going home. Is that okay?
Yes.
And give you some discussion and advice. All right. So before we proceed, is it okay if I just check your understanding of what has been happening thus far since you've been admitted?
Yes, doctor. I was walking, sudden I have shortness of breath, severe shortness of breath. I came to the hospital. I don't know the doctor. He told me there is some air in my lung, and he do for me some procedure, and I feel now okay. I want to go home because I have work.
Yeah, good. I know. Yeah, I'm happy to know that you feel much better now and ready to go home. Okay, but just some conversation and some precautions that you need to put in check after discharge. We just need to discuss that. But before you go, before we go to that, I just want to explain more what has happened. Is this something you want me to do now?
Yes.
All right. So, when you came in, you had something that called spontaneous pneumothorax, and as you've explained, is basically air that have escaped from your lung to the lining of your lungs. I'm just going to draw it for you. This is what it means. This is your lungs, and this is the lining of your lungs. Here, I've escaped from your lung into your lining of your lungs. Okay. And there are
Yeah.
several reasons where people have this. Okay. It could just occur on its own, and we're not quite sure why this. We don't know why. And in some persons, they might have lung problem, and that might be due like maybe like asthma, that might have caused them to have this. But in your own case, it just happened on its own. We don't know the reason. Okay, but because
Okay.
I've looked through your notes and I've looked at your physique, you are quite a bit tall, slim, and it's quite common in young men and people that are tall and slim, like you are. Are you following me, Mr. Samad?
Yes.
Do you quite understand
You mean
what I
that's
process?
serious?
Is that what?
Sorry, doctor. You mean that's serious?
Yeah.
Dangerous for me? I
Well,
am okay now.
yeah. I'm happy to know that you are okay. But because it has happened once, Mr. Samad, there's chances that this can happen in future. I'm sorry to let you know. Though in your situation, it has been treated surgically. Some persons may not need to do surgery, but you have had surgery to treat this condition, okay? And the chances of it happening
Yeah.
again is there. And that is why we need to discuss precautions, things to do to prevent this from happening. All right. Are you with me, Mr. Samad?
Oh,
By the way, Mr. Samad, do you smoke?
yes. Yes.
Okay, and
Yes, I
how many?
smoke.
Okay, how many sticks do you smoke, and for how long have you been smoking for? Hello, are you with me?
Why? Yes, you mean the smoking? It's related to
Yes.
my condition?
Yeah,
Okay.
yes,
I
yes.
can decrease. I
This,
can decrease the smoking, doctor.
all right.
1 or 2 per day. It's okay.
Well, at this point, I'm happy to know that you are considering to cut it down, but it will be more helpful if you can stop smoking totally, because smoking can actually increase your chances of having this. And because you've had it now, your chances of having it compared to other persons is increased. So it would be better. It would be best if you can stop smoking totally. What do you think about that?
I feel it's difficult for me.
Oh, I
You
know.
have any help? You can help me?
Yeah, I can only imagine having to think about stopping to stop smoking, but not to worry. We have good services that we can refer you to if you struggle to stop smoking, that can help you, counsel you, and even give you substitutes that could help you over time to get over the feeling of smoking. How does that sound to you, Mr. Samad?
Yes. Okay. Thank you for it.
You're welcome. And also, I understand that you are a pilot, if I'm right.
Yes.
Okay, all right. And how soon do you intend to go back to work?
They give me now, I think, 1 week sick leave. Then I will back to my work.
Okay, all right. Okay. So, I understand how much you are eager to go back to work after being off for about a week now. The joy of returning back to work. But Mr. Samad, I'm afraid that you might not be able to go back to work now. Okay, and
What you say,
this
doctor?
is because
I cannot go to my work.
yes, for
No, it's
now.
difficult for me, doctor. How I will
I
live? I have a big family, doctor.
Yes, I quite understand how challenges this can be, and it's because this is because when when you go on as a pilot, I mean when you have to fly with pneumothorax, someone that have had ear trapped in his ear lining in the could cause a recurrence of this, and when it happens, it could be life threatening. But not to worry, it's not something for life, okay? I'm not quite sure if it's going to be something for life, but I'm going to make inquiry about this, and we can discuss this later when you come back for your appointment. But in the meantime, I would advise that you notify your employer about your condition, and then they can make suitable adjustment for you at work while we try to find out more about if it's something that would be permanent or just something for a while, and then we can start discussing alternative. Refer you to social worker, see how your occupational therapist, how they can be of help in your management. But for now, I would say inform your employer about this, and then let's take it up from there. What do you think, Mr. Samad?
Oh my God, it's very bad, doctor.
I can
I
I can
like my work. I don't
2 minutes
know for
left.
how much I will stay. For how much I will stay for the without work. I cannot fly. For how much, doctor?
I will say for now, perhaps in the next 1 week. Okay, but the next 1 week, I would say do not fly. But until then, I would make more inquiries about this, especially knowing that you are a pilot. Make more inquiries about this and see if there are if it's okay to resume after 1 week, or it's gonna be a permanent thing. Honestly, I must be honest with you right now, Mr. Sam. I'm not quite sure how long you may need, but for the next 1 week, I would say do not fly until we are able to give you further instruction from the clinic. And this is mainly to prevent life-threatening condition. I know you want to stay as much healthy as you can, Mr. Samad. Isn't that the case?
Ah, yes.
Mm,
Okay,
mm.
doctor.
Okay. But by the way, are you being are you being supported by your company in terms of finance right now? Because I know you mentioned something about your finance.
No, it's a good, doctor.
It's good. Okay, good,
But
good.
I
Thank.
like my job for that. I ask, I cannot stay long time in the home without work.
Yeah, we would do this. We would refer to the occupational therapy so that they can have a chat, comprehensive chat with you about this. Is that okay?
Okay.
All right. Do you understand what we discussed today, Mr. Samad?
Yes, doctor. You mean I have problem in my lung and I cannot flight for
Okay, yeah.
many time till my case improve. You mean like that? I'm right?
Yes, for until we are able to discuss how long this would be. Okay, but for now, do not fly, and also consider to stop smoking. I'll give you leaflet information about this, and then I will give you see you again in clinic with my consultant to have a further discussion. Is that all right?
Okay.
Do you have any question?
Okay, doctor. I want to ask you, I like the diving. It's okay with me?
Oh, that's another thing we need to discuss about as well. I understand it's a hobby, something that you like to do. Okay, but at this point, because you have pneumothorax, Mr. Samad, I'm so sorry that you may not be able to dive again. I know it's difficult to know you have to stop your hobby, but then it's just what we need to do. One of those things we need to do. I'm so sorry, Mr. Sama. You may not be able to dive again, and this might be for life.
Okay. Really bad. Okay, thank you, doctor.
I'm so sorry once again, Mr. Sama. Thank you.
No, thank you for you, doctor. Thank you.
You're welcome.
Okay, well done. Thank you, Dr. Ayula. Dr. Al-Huda, you can comment now.
Really, she good. She convinced me I will stay in the home, and she must ask about the hope diving or hiking. It's he cannot. She must ask me about this, okay? Only, but she's answer all my concern. And she talk about smoking, and I must stop smoking. And because this patient treated by the surgical for pneumothorax, he cannot fly at least 6 weeks, okay? And they need to repeat it, the X-ray, and we'll check if there is still air in the lung or no. She's very good.
Yes, I agree with you also. She convinced and she researched about the cause and she addressed the concern about the flight, ability to flight again. But please be sure about the duration, Dr. Ayula. It's 6 weeks, not 1 week. Okay? And in case of recurrent pneumothorax, the patient or the pilot cannot fly unless he has what? Dr. Ayula? If you have recurrent pneumothorax with pilot, you can hear us? You are unmuted? Anyway, so if we have first pneumothorax and it's spontaneous one, the patient will stop flying for 6 weeks. Then he will be reassessed, checks chest X-ray again. If everything okay, he can fly again. If he had recurrent pneumothorax, he cannot fly unless he has pleurectomy. Okay, this is the solution only to fly if he has recurrent pneumothorax. Otherwise, the scenario should be derived like this from the start, the introduction and the asking about the background, as you did exactly, the expectation and the pathophysiology. The drawing is very good option here. You can draw the lung and as I draw on behalf of you, Dr. Ayula. You can see the drawing on the screen simply.
Okay.
So yeah, it's just triangle and another triangle for the lining area or the lining layer and the air in between. So in your condition, it happened spontaneously because of some risk factor that you are tore or whatever. And in some patients with the smoking, it can be the trigger for it. So for your sake, you should stop flying temporarily, and we reassess you if it happen again. So you have to have surgery before flying back. Yes, I know you are interested to do your job. However, we can ask your aviation company to reallocate you until you'll be fine or free of this symptom, short of breath or the pneumothorax itself. So this is the scenario, how to do it. It's common scenario, by the way, pilot with pneumothorax. Don't forget to stop flying for 6 weeks at least and to be reassessed back, doing chest x-ray. And we cannot allow you, or you have to notify your company that you don't have any agreement to fly unless you are having the fitness paper from us. Okay, some scenarios he will insist on you. No, doctor, don't try it. Please, doctor, I want to do. It's harmful to fly in this situation. You might have harm yourself and others. You have passengers with you, and you might have this pneumothorax in the air, possibly because of the pressure difference, and the air will be growing more, and it might even threat your life. Exactly as you did. Even you can draw again with the big air around the lung, and this air might threat your life. I mean tension pneumothorax, but no need to mention the name of the complication. But it's something to threat his life as well as the passengers. So it's not something to be allowed for the other safety and for your safety as well. Smoking, support, alcohol, you have to, I like when you ask him about you are a pilot, so you know that, or the examiner will know that you read your scenario well. You're not just talking to the patient or the surrogate asking about everything. You have to show the examiner that I'm taking care about everything written in the scenario. So one of these things, the job, I read that he's pilot, so you can tell him, oh, I can see from the note that you are a pilot. Can you tell me how the impact on you on this job? Then he will tell you, yes, doctor, I want to be back to my job, and so on. So whenever written in the scenario, try to show the examiner that you are taking care and you notice it. Not everything to ask the patient. Okay, and be sure about the data, Dr. Ayula. Don't ask the patient about his age.
Okay.
Yeah, okay, so you will also show the examiner that you are hesitant. You didn't read your scenario well. You didn't write the age. So you will write the patient age and name initially, the job and the task, and some of your notes like smoking, like driving, like hobbies, as in this scenario, which is very good idea also to raise it. You have any hobbies, particularly what?
Diving.
Hiking is very important, as well as the diving. So any change in the pressures or the height will change the pressure inside the lung, and it might increase the risk of pneumothorax or even the size of pneumothorax. So it should be addressed, and you can give him some advices not to do it temporary unless he has the surgery again. Diving, I think something permanent, prohibited to be done with the pneumothorax patient. It's more risky than the ascending or the flying, right? Is it clear now for all? 6 weeks, don't forget this duration.
Yeah,
It's very
6 weeks.
common.
Yeah.
Yeah, and you have to know it. If he has recurrent, he should be stopped unless he has the bilirectomy, the surgery where we are removing the lining area or the lining layer of the lung by surgery. Whatever the surgery, either a glue or doing surgical by VATS, video assistant thoracoscopy. Is it clear now for you, Dr. Ayula?
Yes, it's
Any
clear. Thank
comments
you.
or question?
No,
Okay. Well
thank
done.
you.
Thank you to any question, Dr. Huda.
No, thank you very much, Doctor.
Okay. Most welcome. Anyone with question? Anyone has comments, suggestion? Dr. Sarah wrote 2 weeks. No, it's 6 weeks.
Honestly,
I am sure
I usually
about.
think it's 7 weeks or 7 days, 1 week before. What until now, honestly.
Okay. Okay. To be
But I've checked.
more
It's 6 weeks
diplomatic.
actually. I've checked. It's 6 weeks.
Yeah, it's 6 weeks. This is
Mm.
a definite answer. But to be diplomatic, if you don't know, you can say few weeks until you will be reassessed back. if you are not sure. The same as for driving with some disease. You will be stopping your driving for several weeks, few weeks, several weeks, couple of weeks, and I will be back to confirming this information for you. Okay, if you are not sure. If you are sure, say it. If not, you can say in this diplomatic way, I will be back to you updating this duration, but it might be several weeks. So several means from 1 to 10. You didn't give sharp timing, and at the same time you stop him. Okay. Yes, it's 6 weeks. I agree, and I am sure, pretty sure, 6 weeks. If he want to fly as passenger, 2 weeks. Okay, thank you, Dr. Sarah. Anyway, we are not bringing patient with as a passenger, but sometimes maybe the scenario the patient have a concern that he want to go to a wedding or an event and he want to fly. Yeah, some scenarios. But in this time, you can just tell him, I will refer you to the aviation regulation. They will tell you when exactly you can fly. It's not requested or it's not something needed from us to know about even the passenger. Paces wise, before they brought this scenario as pilot, so we have to know the duration because this scenario is still coming nowadays. You have to know the duration of the pilot flying. For the passenger, okay, Dr. Sarah wrote 2 weeks. I'm not sure, but if it is 2 weeks, so you can mention it. If you are not sure, you can refer him to the aviation regulation and we will tell him if he can fly or not. If you are not sure, you can ask your senior. Okay. Anyone with question? Any doubts regarding both scenarios today? Any suggestion? Clear for all? All are satisfied? Okay. Thank you, Dr. Ala.
Thank you so
Thank you.
much, everyone.
Thank you. Most welcome, Dr. Ayula. Well done, both of you. Thank you as well, Dr. Ayula and Dr. Huda. We will wish you a nice weekend. See you, inshallah, next week. The next week will be with the short clinical day. So we will do short and long and communication. Thank you, everyone. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Aywa? Yes? Anyone calling? Okay. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.